Hi, I'm Bradley and I'm studying sports exercise rehabilitation. Today I'm going to complete an assessment of the knee joint. Prior to this I've completed a subjective assessment and I'm going to move on to an objective assessment with the consent of my client. Do I have your consent?
Yeah.
Thank you. As my client entered the clinic, I completed a visual assessment which was checking to see if there was any swelling, bruises, scars, abrasion, any discomfort in the face of when the client was walking in. I also checked for valgus and varus of the knee, which is rotation, which is lateral or medial rotation of the knees. I'm now going to conduct a gait analysis of my client. So if my client would just like to take a walk. Here I'm just checking for the heel toe action, that there's no discomfort in the face visually, or my client isn't in pain, he's well balanced, and there's no weight transfer within the walk that he's completing. I'm now going to conduct the palpation side of the assessment, which requires my client to be in the supine position as shown, and I'm going to do a sweep test of the knee, checking for any fluid around the knee. I'm going to do this on both sides. I'm then going to move on to the patella test, which is checking for the knee effusion, and a muscular bulk test, which is checking for any muscular imbalance between the legs. And I'll be assessing my client's active movement assessment, in which this will assess the knee joint, and my client's just going to, by himself, just make extension and flexion of the knee. And with this, I'm going to be checking for any pain, discomfort, any popping, the range of movement that the knee makes, and any clicking that may occur when this takes place. So this time I'm going to do the assessment with my client, as it's a passive assessment, and I'm going to still be looking for the popping, the clicking, any discomfort within the joint, and it's still going to be the flexion and extension. So if you just like it. This side of the assessment is looking at the internal structure of the joint. I'm now going to go through the resisted assessment of the knee, and this is again looking at the discomfort, the clicking, the popping, any pain and incline may be in. So if you'd like to flex your leg, and I'm just going to apply some resistance, and if you'd like to extend your leg, and again just applying some resistance. And this time we're looking at the muscular structure and the movement around the knee. We're now going to move on to the special test, which is the McMurray's test, and this is checking any meniscus damage. So I'm going to rotate the knee laterally and in a medial way as well. So if you just like it. A positive test would show that there will be clicking and discomfort, and meniscus tears are a common injury at the knee, and other common injuries at the knee include dislocations, fractures and ligament damage. I'm now going to conduct another special test, which is checking the ACL and the PCL. So I'm just going to sit on my client's foot, and I'm just going to check the PCL and the ACL, and again. And a positive test for this would be like a mushy end feel, and you would feel the... So a positive test for this would be a mushy end feel, and the tibia would translate around, well, over 6 millimeters. There's different types of grades for tears in the ligament, so it goes from grade 1 to grade 3, grade 1 being the minimal and grade 3 being the worst tear you can have. So another ligament test is the MCL and the LCL, and this is going to be a positive test if there's gapping in the medial or the lateral of the knee. Obviously there'll also be pain from my client if the test is positive as well. And now we're going to do the functional test, which in which the client's going to take part in a squat. This is going to check for valgus and varus, the range of movement and the depth of the squat. And this concludes my objective assessment.